Welcome to the deep dive. Today we're diving into something pretty complex, Alzheimer's disease. I've got a
Yeah.
whole stack of articles and reports here.
Yeah.
But this one, from the National Institute on Aging, Unraveling the Mystery of Alzheimer's Disease,
Mhm.
really seems to be at the heart of what you want to explore.
Yeah.
And I get it. This is something that touches a lot of people. Maybe you have a family member dealing with this, or perhaps it's, something you worry about for your own future.
Right.
Or maybe you're just fascinated by the brain and how it all works.
Yeah, absolutely.
Whatever your reason, we're going to try to break it all down, make sense of the science.
Mhm.
And who knows, maybe we'll even uncover some surprises along the way.
I think we will.
Okay, so before we get lost in the weeds, let's start with the basics.
Hmm.
What exactly is Alzheimer's?
Well, it's the most common cause of dementia.
Yeah.
Which basically means a decline in cognitive function, like your
Yeah.
ability to think, remember, reason. And it gets severe enough to, really interfere with daily life.
So we're not just talking about, like, forgetting where you put your keys.
No. This is different. It's important to remember that Alzheimer's is not a normal part of aging.
Cool.
It's an actual disease.
Got it.
It attacks the brain. And, it gets worse over time.
So how does it actually attack the brain? Like, can we get a visual here?
Sure.
Yeah.
So imagine your brain is like a vast library.
Yeah.
Filled with billions of books, right?
Mhm.
Each one representing a memory.
Okay.
To access those memories, you have librarians, millions of them,
Okay.
zipping around on a complex network of walkways.
Wow, I like that.
Yeah.
So are those librarians our neurons? Is that what we're talking about?
Exactly. Each neuron is constantly sending and receiving messages, forming connections, accessing information. It's really amazing.
It is amazing.
Mhm.
So how does Alzheimer's, mess with this whole system? What happens?
Well, imagine if construction started in our library.
Oh.
Walkways get blocked, shelves collapse.
Right.
Some librarians even get lost or trapped.
Oh, no.
So communication breaks down, information gets harder to access.
Yeah.
And eventually, sections of the library just fall into disrepair.
That's a pretty vivid picture.
Yeah.
So what are the construction crews in this scenario? What's causing all this damage?
The main culprits are, well, we call them plaques and tangles.
Okay.
They're both related to proteins, but these proteins have kind of gone rogue.
Okay, so plaques and tangles.
Right.
Let's start with plaques. What are they exactly?
Plaques are sticky clumps of a protein
Okay.
called beta amyloid.
Okay.
They build up outside of the neurons,
Okay.
kind of like, like gum stuck to the bottom of your shoe.
Ah, got it.
They basically interfere with the transmission of messages between neurons.
So they're blocking those walkways, those connections in our library.
Exactly. Now, imagine the tangles. It's as if those librarians themselves, are getting tangled up. Their internal systems are breaking down.
Okay, wait, so tangles are happening inside the neurons,
That's right.
not outside like the plaques.
Right, inside. They're formed from a different protein called tau,
Okay.
which is normally involved in stabilizing the neuron's structure.
Right.
But with Alzheimer's, tau gets all twisted and tangled, which disrupts the neuron's internal transport system. And that eventually causes it to die.
So it's like plaques are blocking communication from the outside and tangles are causing chaos from within.
Yeah, that's a good way to put it.
No wonder those neurons can't function properly.
Exactly.
And as this damage spreads, you start to see the symptoms of Alzheimer's.
Right. And here's the thing.
Yeah.
This damage, it can begin years, even decades, before any outward signs even appear.
Wow. So someone could have these plaques and tangles forming in their brain and not even know it.
That's right. That's one of the biggest challenges on Alzheimer's research.
So is there any way to know, what's going on in our brains before the symptoms start showing up?
Well, that's where some of the newer imaging techniques are giving us a glimpse. Imagine being able to actually see those blocked walkways and, those tangled up librarians in real time.
So we're finally getting a chance to see the crime scene as it unfolds.
Yeah, you could say that.
Well, that's got to be helpful for diagnosis, right?
Mm.
If you can see what's happening.
Absolutely. And, the earlier we can detect these changes, the better chance we have of intervening,
Okay.
potentially even slowing down the progression of the disease.
Wow. That is a glimmer of hope, isn't it? But we've only just scratched the surface here. We'll continue our deep dive next time, exploring the latest research and what it all means for you. Okay, so last time, we left off with this image of, like, plaques and tangles, messing with our brains, like some kind of, rogue construction crew.
Right.
But the big question is, What gets those crews started in the first place? What causes Alzheimer's?
Well, that's the million-dollar question, isn't it? And unfortunately, there's not a simple answer.
Yeah, I figure.
It's kind of like trying to solve one of those really complicated jigsaw puzzles where you're missing some pieces and the ones you do have don't quite fit.
Right.
We know genetics play a role,
Okay.
lifestyle, environment,
Mm-hmm.
but the exact hows and whys, it's still a big mystery.
Okay, so let's start with genetics.
Yeah.
I've heard there's a gene that increases your risk of Alzheimer's. Is that true?
Yeah, there's a gene called APOE,
Okay.
and it comes in different versions. Like, think of it as different editions of the same book, right?
Okay.
One version, we call it APOE4. It's like an edition with a few pages missing or maybe some misprints.
Okay.
If you inherit that version, your risk of developing Alzheimer's goes way up.
But it doesn't mean you'll definitely get it, right?
Exactly. Having that APOE4 gene, it doesn't mean you're doomed.
Okay,
It
got it.
just means you're more susceptible.
So it's like what?
Well-
A weaker spot in your library's foundation?
Yeah, that's a good way to think about it.
So if someone knows they have this gene,
Yeah.
what can they do? I mean, is there anything?
Well, that's where research is getting really interesting.
Okay.
They're looking into whether lifestyle changes, like the Mediterranean diet,
Right.
regular exercise, if those things might be even more beneficial for people with that APOE4 gene.
Okay.
Like maybe you can reinforce that weaker foundation, you know,
Right, right.
and possibly even prevent those construction crews from causing too much damage.
So it's like having this gene kind of gives you a heads up,
Mm-hmm.
a chance to be more proactive about your brain health.
Exactly. And there's also research into drugs that could target the gene's effects, you know, maybe offer another layer of protection.
That's really good to hear.
Yeah,
So knowledge really is power in this case.
absolutely.
Okay, so we've talked genetics. What about those lifestyle factors? I keep hearing about the mind-body connection, right? How does that all fit in?
Well, the more we learn, the stronger that connection seems to be. We've known for a while that cardiovascular health and brain health are linked.
Okay, yeah.
What's good for your heart is good for your brain.
Right, but how are they connected? Like literally.
Well, think of your blood vessels like the delivery trucks that bring essential supplies to our brain library.
Okay.
If those trucks get stuck in traffic because of high blood pressure
Mhm.
or clogged arteries, those supplies don't get where they need to go.
So the library can't function properly.
Exactly.
Got it. So keeping those delivery routes clear
Ooh.
is key. What about other lifestyle stuff? Does diet play a role?
Huge role. Diet is basically choosing the fuel for those delivery trucks.
Okay.
Some fuels are clean, efficient.
Okay.
Others are dirty and lead to breakdowns.
Like fruits, veggies, healthy fats. That's premium fuel for the brain.
Exactly. And the opposite, you know, processed foods, lots of sugar, unhealthy fats, those are linked to more inflammation, which can damage those delicate walkways and librarians we talked about.
It really highlights how everything's connected. you know? The body is such a complex system.
It really is.
Okay, so even if you live a super healthy lifestyle, can you ever be 100% sure you won't get Alzheimer's?
Honestly, no.
Yeah.
There's no foolproof prevention method yet.
Okay.
But research is helping us understand the risk factors better, and early detection is getting more sophisticated all the time.
Speaking of detection,
Yeah.
how is Alzheimer's diagnosed? I
Yeah.
mean, can doctors run a test and just know for sure?
I wish. It's more like piecing together a puzzle, you know,
Yeah.
using different tools and observations. Doctors will start by taking a detailed medical history, talking to family members about any changes they've noticed,
Okay.
and they'll do physical and neurological exams.
So they're looking for clues, seeing if everything points to Alzheimer's.
Exactly. And then there's neuropsychological testing.
What's that?
It involves specific questions and tasks to assess memory, language, thinking skills, like putting those librarians through their paces, seeing if they can still find the right books.
Right. Deliver those messages.
Right.
And what about those brain scans? Are
Mhm.
those being used more and more for diagnosis?
Yeah, especially MRI scans.
Okay.
They can show structural changes in the brain, like shrinkage in certain areas, the hippocampus, which is crucial for memory. That's often affected.
It's like seeing those sections of the library starting to, I don't know, decay and crumble.
A good analogy.
Are there other types of scans?
There's PET scans. Those can measure brain activity and show you areas where neurons are struggling to communicate.
So it's like those sections of the library where the lights are flickering and the equipment's malfunctioning.
You got it.
It's amazing how much we can see now, what's happening inside the brain. But the question is, what can we do about it?
Yeah.
That's what I really want to know.
Yeah.
We'll dive into the treatment frontier next. Okay, so we're back and ready to tackle the big question.
Hmm.
What can we do about Alzheimer's? What does treatment look like?
Yeah, this is where things get, well, hopeful, but also challenging. We don't have a cure yet.
Right.
But there's a lot of really promising research happening.
Okay.
Scientists are working on a few different fronts. Drugs to help maintain mental function,
Mm-hmm.
therapies to try and slow down or even halt the progression of the disease,
Okay.
and ways to manage the symptoms because they can be really tough.
Right, so let's break those down. What about those drugs that help people maintain their mental function?
Mhm.
How do they work?
One type that's commonly used, especially in the early stages, are called cholinesterase inhibitors. Remember those librarians we were talking about?
Yeah.
These drugs basically help them send messages more effectively, boost communication between neurons.
So it's like giving those librarians, what, a little extra caffeine boost,
Yeah.
helping them stay on task?
Something like that. They can't reverse the damage that's already been done,
Right.
but they can give people a temporary improvement in memory, thinking, sometimes even behavior.
So it's like patching up those walkways a bit,
Yeah.
helping those librarians find their way around. But what about slowing down the disease itself? Is there any hope for that?
That's where things get really interesting. Researchers are looking at so many possibilities, from anti-inflammatories to antioxidants, even therapies that go after those plaques and tangles directly.
Wow.
There's even some research into an Alzheimer's vaccine.
Wait, a vaccine like for Alzheimer's?
Yeah, it sounds crazy, right? But it's basically training the immune system to clear out those amyloid plaques.
Wow, that would be amazing. Like shutting down those rogue construction crews before they can do too much damage.
Exactly. It's still early, but the potential is huge.
That's incredible. But, even with all this research, Alzheimer's is still a really hard disease to live with, both for the person who have it and for their loved ones.
Absolutely.
What kind of support is out there for families, for caregivers?
You're hitting on a really crucial part of this whole thing.
Yeah.
The toll it takes on families, emotionally, physically, financially, it's immense.
Yeah.
One of the most important things we can do is support caregivers.
Mhm.
They're the real unsung heroes.
The report we were looking at, it talks about caregivers facing the long goodbye.
Yeah.
It's such a powerful phrase, that slow, often heartbreaking decline that families have to witness.
It's tough. There's no way around it. And it's not just one type of caregiver either. Spouses, children, siblings, friends, they all have different roles, different challenges.
It really does take a village. I know there's been some interesting research on how technology can help too. What have they found?
Well, back in the 80s, researchers started looking at computer-based support groups for caregivers.
Oh, wow.
And the results were pretty amazing.
Really? What did they find?
Caregivers who use these online forums, they felt less isolated, more connected, more empowered. They could share their stories, ask questions, get advice from people who understood what they were going through, all from home.
So even though they were physically alone, they had this virtual community.
Exactly. And it's not just about information, it's about connecting on a human level, sharing those emotions, finding comfort in knowing you're not alone.
It's amazing how technology can do that, build bridges, even when we're facing something as difficult as Alzheimer's.
Yeah, it really is.
So as we wrap up our deep dive here, what's the one thing you hope our listener takes away from all of this?
I want them to know that Alzheimer's is tough, but we are not powerless.
Mhm.
Research is moving so fast, and with each new discovery, we get closer to understanding how to diagnose it, treat it, maybe even prevent it.
And for those who are already dealing with it in their families or themselves, you are not alone. There is support out there, online, in your community. Reach out, connect, keep learning.
If brain health is something we should be thinking about our whole lives,
Yeah.
what are you doing today to invest in yours?
That's a great question, a question we should all be asking. Thanks for joining us on this deep dive into Alzheimer's. We'll be back soon to explore another fascinating topic.